In honor of World AIDS Day, let's talk about Gaétan Dugas, otherwise known as Patient Zero, the French-Canadian airline steward whose insatiable sex drive and psychotic disregard for his partner's health was blamed for bringing HIV/AIDS to the United States. But it was all a lie. Welcome back to Yesterqueers. My name's Amanda, and I'm a public historian of queer history. The first confirmed death from AIDS in the U.S. was, we think, a 16-year-old black boy from St. Louis named Robert Lee Rayford, who died in May of 1969. But we wouldn't know the cause of his death until a preserved sample of his tissue was tested in 1987. The first reported cases of what we now know to be AIDS were in Los Angeles in 1981. 5 men were admitted to the same hospital with similar immune deficiency, unexplained swelling of the lymph nodes, and a rare type of pneumonia. Later that year, a cluster of gay men and another in Los Angeles were diagnosed with Kaposi sarcoma, an extremely rare type of cancer that we now know can occur in people with HIV. By December 31st, 1981, 337 cases of severe immune deficiency had been reported to the CDC, 130 of whom had already died. Medical researchers started referring to this emergent disease as gay-related immunodeficiency, or GRID, which reinforced the idea that being gay was the cause and led many gay and bisexual men to assume that they were already doomed to die a slow and painful death. Nobody knew why gay and bisexual men were so susceptible to KP, or why so many of them were suddenly presenting with severely compromised immune systems. For a few terrifying months, epidemiologists actually thought that cancer had somehow mutated to become infectious. Then, for a while, the most popular theory was that the use of poppers, combined with frequent exposure to semen and to the known viruses that circulate among people in groups, was overloading gay and bisexual men's immune systems and leaving them open to rare infections. Since they had no idea what they were looking for, epidemiologists did what they often do at the beginning of a new outbreak, and they started to map the cases. 3 of the original 5 men in Los Angeles had slept with each other, which gave researchers on the CDC's task force an inkling that perhaps this gay cancer was infectious. Dr. William Darrow flew out to Los Angeles to interview about a dozen patients, 4 of whom reported having slept with a handsome Air Canada steward named Gaétan Dugas. In an interview for the documentary Killing Patient Zero, Gaétan's friend Ray Redford described him as a man on the glittering edge, flamboyantly and defiantly and happily gay. He was known for his megawatt smile and easy laugh, and for the way that he tailored his uniforms to complement his best assets. Born in 1952 and raised in Quebec City, Gaétan loved his job. As a steward for Air Canada based in Toronto, he crisscrossed both the US and Canada. He was young, he turned 25 in 1977, he was handsome, and he loved to socialize. He went out in a different city every night and later told the CDC that he averaged 250 sexual encounters a year from 1979 to 1981. Dugas went to the doctor in January of 1980 for unexplained fevers and swelling in his lymph nodes. Later that year, he was diagnosed with Kaposi sarcoma, and in 1981, he flew to New York for treatment, where his case was reported to the CDC. Gaétan Dugas was designated as patient number 57. When the CDC reached out to Gaétan to interview him, he was incredibly forthcoming. He kept detailed notes about his sexual encounters and shared them freely with the CDC, giving names and contact information for his 72 most recent partners. He also agreed to fly to Atlanta to have blood and tissue samples taken for testing. Dr. James Curran is on record as saying that Gaétan's cooperation was crucial in figuring out, first, that AIDS was caused by an infectious agent, and second, that it could be transmitted sexually. While he was healthy enough, Gaétan did continue to socialize after his Kaposi sarcoma diagnosis, but so did most gay men in the first couple of years of the epidemic, because nobody knew that this gay cancer was contagious. I know that that sounds wild to a modern audience, but we truly didn't know. And public health officials who bothered to respond at all were throwing everything at the wall, hoping something would help. Gay and bisexual men who were barely a decade removed from Stonewall were rightfully suspicious that suggestions to stop going out, to stop doing poppers, to at least limit the number of sexual partners you had, was a coordinated effort to drive them all back into the closet. The task force published their findings in 1984, just a few months after Gaétan's death. By this point, GRID had been renamed to AIDS, and the task force discovered that 40 patients across 10 cities were linked by sexual contact, which supported their hypothesis that AIDS was caused by an infectious agent. Because Gaétan was the only non-US patient, and because he had provided the most connections, he was placed at the center of the map, and his patient number, 57, was replaced with the letter O, meaning outside of California. That O was almost immediately misread as a 0, and the media ran with the idea that the AIDS epidemic in the United States had a patient 0. But Gaétan's identity was a secret until Randy Shilts started writing his landmark book and the band played on. Randy Shilts was the first out gay reporter for the San Francisco Chronicle and the first journalist in the US to cover a specifically queer beat for the mainstream press. He was one of the only journalists in the country writing about the emerging AIDS crisis, and he was compelled to write his book by what he saw as the abject failure of state and federal governments, the medical community, the queer community, and the press in adequately responding to the crisis. Despite strong objections from the CDC, Shilts thought that it was imperative to name patient zero in his book, so when the CDC wouldn't cooperate, Shilts tracked him down himself. Gaétan Dugas was one of countless gay and bisexual men who had hundreds of sexual partners in the hedonistic, sexually liberated years between Stonewall and the start of the AIDS crisis. And Dugas had been extremely helpful to the CDC task force that was frantically trying to figure out why gay and bisexual men were dying and how to stop it. And yet, Shilts chose to make Dugas into a villain, a beautiful and exotic predator satisfying his, quote, voracious sexual appetite with unsuspecting men from New York to Los Angeles, a, quote, sociopath driven by self-hatred and inner turmoil. And because the idea of gay men getting their comeuppance for their amoral behavior was so alluring to the homophobic media, that is the excerpt that Shilts' publisher sent around to spark interest when it looked like his book might be a colossal flop. The three people responsible for painting Gaétan Dugas as a villain and igniting the firestorm around Patient Zero, author Randy Shilts, his editor and publisher Michael Denny, and a publicist who was also an ex of Denny's, are all gay men. This wasn't straight people looking for a scapegoat. This was gay men demonizing promiscuity, blaming a deadly epidemic on a man that they saw as morally corrupt, and exploiting an entirely fictional narrative to sell books, a thing that they believed they were justified in doing because America was in deep denial about the AIDS crisis, and Shilts' book being successful would force AIDS into the national conversation. Of course it worked, and The Band Played On was on the New York Times bestseller list for 5 weeks, and it won a Stonewall Book Award. It was translated into 7 languages and adapted into a film. It is a nearly 700-page tome of investigative journalism that outlines all of the ways in which the government, the medical establishment, and the press failed to address the AIDS crisis until tens of thousands of people had died. It is a remarkable piece of work, and it did shift the national conversation. I think Randy Shilts probably believed the story he told himself and us about Gaétan Dugas, but none of it was true, and it had a devastating effect. It reinforced the idea that AIDS was punishment for deviant behavior and that foreigners bring chaos and disease to our shores. It provided fuel for politicians demanding laws to criminalize transmission of the virus and justification for those who are happy to just let people die because they saw AIDS as the natural consequence of living a perverse lifestyle. This is why I say that wanting to assimilate into the dominant culture, that refusing to unpack internalized homophobia and transphobia is dangerous. It makes you an accomplice to your own oppression and gives your antagonists weapons that they will use against you. Medical historians and queer activists tried to clear Gaétan Dugas' name for decades, but he wasn't fully exonerated until 2016, when a group of researchers studying the early genetic diversity of the HIV-1 epidemic tested a sample of his blood and found neither biological nor historical evidence that he was the primary case in the US or for subtype B as a whole. Of course, those findings didn't make nearly as many headlines. That's it for today. As always, more information, including sources and further reading, is available in the usual place.